morning, everyone. Earlier, I talked about anticipatory grief, and that's grief that happens before your loved one passes away. And then I told you guys that I was going to talk about some of the symptoms of anticipatory grief. And the first one that I mentioned on yesterday was depression. And so just to kind of recap what I talked about the symptoms and the signs, and talked about the fact that depression isn't anything to be ashamed of. Oftentimes people think that it's the sign of weakness, or that you can just kind of shake it off and, get over it. You'll be okay. Stop whining, stop complaining. Depression is not that simple. If you have been dealing with some of these feelings of hopelessness, and if you've lost energy, you don't want to do things that you usually like to do, if you're having thoughts of just desperation and suicide, or if you're having a lot of trouble thinking and concentrating, dealing with sudden weight loss or sudden weight gain, then you need to go talk to a physician to, first of all, rule out whether or not you have some sort of physical condition like thyroid problems, or vitamin deficiencies or things of that nature, before you just jump to the conclusion that you're dealing with depression. But once your doctor rules all those things out, just consider that that might be what you're dealing with. Now, I mentioned yesterday, like I said, that depression isn't anything to be ashamed of. It's something that I've struggled with for about 22 years. And look at me, I'm doing pretty good and loving life. And I'm able to take care of my loved ones and provide them a better quality of care, because I'm taking care of myself. Now, I mentioned that medication is an option, but for some people, they're just not willing to try medicine. They are reluctant to take any pills or anything like that. And I completely understand that. I do want to share with you that antidepressants are not addictive. So if that's one of your concerns, then, just kind of put that one to the side. But if you decide that you want to take your doctor's advice and try antidepressants, ask him or her how long they think it's going to take for the medicines to kick in. Sometimes it takes from 4 to 6 weeks before you feel completely better. So do talk to your doctor about that. And if you decide to start taking them and they don't seem to be working, or you're having symptoms or side effects that you don't like, please do not just all of a sudden stop taking them on your own. That's called self-medicating. And so you don't want to self-medicate. So talk to your doctor about weaning you off of them. As I said before, they're not addictive, but they are changing or correcting things going on in your brain to help relieve those depressive symptoms. It is a brain-based disease. It doesn't mean you're crazy. It doesn't mean that you're weak. It is a brain-based disease. Now, another thing that's very important is counseling. If you decide to take the medicine, great. But what you need to know is that medicine is not going to cure everything, because you've developed a pattern of thinking that's unhealthy. So talk to your doctor about references to counselors, social workers, psychologists. They've been a very important part of my recovery process, and it can be very effective in the treatment of depression. And it can help you deal with the problems that are facing you. Listen, we are under a lot of pressure as caregivers. And we just really don't realize what kind of strain it's putting on our minds and bodies. And so sometimes it's very helpful to have a non-judgmental person to talk to. Someone who's not a family member, someone who's not a friend, someone who's going to keep your secrets and your deep thoughts and concerns private. So as I said, consult your primary care physician, and some medium and large companies have what's called an employee assistance program. And that's a program that you can, that kind of goes through your personnel office. But what's great about the EAP program is that everything is anonymous. So if you contact the EAP program, then they can refer you to doctors, and they can also provide you some additional information. Your boss doesn't find out about it. Nobody finds out about it. It is against the law, against privacy laws for the EAP to share any kind of your information. Another thing besides medication and counseling has to do with you just changing your way of thinking. Okay, that's one way to cope. We tend to have so many negative thoughts when we're caregivers because there's so many negative things coming at us from all directions. So in addition to seeking help from a professional, just take some steps on your own to kind of change your way of thinking. Some people like to read scriptural or devotional materials. Some people like to read self-help books. So consider that as part of, 5 minutes of your daily routine. You deserve 5 minutes a day to take care of your mental health. Let your family and friends help you. If somebody has asked you whether or not you need any help, say yes and tell them what you need help with. You gotta give yourself a break, and you got to give yourself permission to deserve help. You can seek out caregiver support. You can do a quick Google search in your town and just type in, dementia support groups or dementia respite care, and you'll get a bundle of companies or ministries that provide those services. Try journaling to get your thoughts out of your head and on paper. I also journal because, I'm thinking about so many things, and thinking about my parents' condition, thinking about how it's hurting them, thinking about how it's changing the dynamics of our relationship. So I have to journal. I have to write that down and just kind of get it out of my system. If you don't want to write, what you can also do is just talk into your telephone's recording app. I do that as well because I just have to get it out of my system. Okay, learn how to relax and manage stress. I know that's kind of hard to do. Okay, Michelle says, go learn how to relax. Well, some tips that I can offer are meditation, deep breathing exercises, walking. There's a lady named Leslie Sansone, Sansone, and she has 20 and 30-minute walking routines that you can do in your home. They're free, and that routine really does help me. And I also use a guided meditation app. It's not, some people think that that's, anti-Christian or anything like that. These meditation apps have absolutely nothing to do with religion. They have everything to do with learning how to breathe deeply and center your thoughts. And finally, take time for yourself. Just do something you like doing. That's one of the struggles I've had. I have really had a difficult time just doing anything fun. My husband asks me all the time, you want to go to the movies? You want to grab something to eat? And I'm constantly saying, well, no, I'm tired, and, I need to do more for myself. And I want to encourage you all to do more for yourselves as well. So just take care of yourself. If you don't take care of yourself, you're not going to really be able to take care of your loved one, and you deserve to take care of yourself. So I hope this helped, and you have a great day.